We have patient Candice Carmel, female, date of birth 1/19/1961, post-op day 2, came in with diverticulitis resulting in a colectomy. Patient has nausea, vomiting, and abdominal distension. Order has been implemented by physician to insert a nasogastric tube on low intermittent suction. I will now go into the patient's room and perform this procedure. Knock, knock. Can I come in? Thank you. Closing curtain for patient privacy. Hello, Miss Carmel. My name is Brittany. I'm going to be your student nurse today. Before I begin, can I have you verify your full name and date of birth for me, please? Candice Carmel, 1/19/1961. Thank you, Miss Carmel. So, Miss Carmel, how are you doing today? You're doing just okay? What seems to be the problem? Having some nausea, vomiting, and you start noticing your stomach starting to bloat? Okay. I'm so sorry to hear that. Well, Miss Carmel, that's actually why I'm here today. I had just talked to your physician about the symptoms you've been feeling, so your nausea, your vomiting, and the bloating in your stomach. We like to call that abdominal distension. Bloating is a cause of abdominal distension, or is a symptom of abdominal distension because of the buildup of gas into your stomach. And your physician has ordered a nasogastric tube, or an NG tube, to be put inside of you, and that's why I'm here. I'm going to put it inside of you today. Do you have any questions before I begin? What is an NG tube? So an NG tube is a hollow, pliable tube that is connected to a suction, as you can see here, intermittent suction, and it's going to go through your nose and all the way into your stomach. So once it's at your stomach, it's going to help decompress the stomach. So it's going to remove any secretions or any gaseous substances, and it's going to help relieve that abdominal distension. So it's going to help decrease that bloating. Do you have any other questions? Why is this happening to you? So since you just had surgery, a common complication after surgery is paralytic ileus. And what that means is the movement of your intestines is either slow or absent. And because of that, the movement of the intestinal content is either really, really slow, or there's a backup of it. And that's where it's causing the bloating and then the abdominal distension. And with that NG tube placed inside of you, again, it's going to help relieve it, and by removing those gastric secretions into that intermediate suction. Any other questions? Will this be painful? I will tell you this, you will feel uncomfortable. It will be uncomfortable. When I insert the NG tube into your nose, you will feel a burning sensation, and when it's in the back of your throat, you will feel like you want to gag. But if we work together, I will be able to insert this NG tube efficiently and quickly, and you will feel little to no pain. Why is the tube blue? Well, the end of the tube is blue because, also known as a pigtail, because it is known as an anti-reflux valve. And basically what that means is, as the NG tube is removing those secretions into that suction tube, it's going to let air in. So it's going to help prevent reflux. So the gastric contents being removed in a different way than it's originally supposed to. What are some complications that can occur with this procedure? So some complications will include loss of skin integrity, because since this tube is on your nose, taped to your nose for an extended period of time, there may be some friction, and that can cause loss of skin. And ways that I can prevent this from happening is that I will do daily skin assessments, make sure there's no redness or inflammation, and I will put some lubricant onto the NG tube before I insert it into your nose, so it can NG tube can slide in more smoothly. And the other complication is aspiration. So the NG tube is going to pass through your respiratory system before it gets to your stomach, and when the gastric secretions are being removed, it sometimes could leak out into your lungs. and that can cause aspiration. So preventions of this would be, I would elevate the head of your bed to about 90 degrees when I am feeding your medications or when you are eating. And after you're done eating, I will have you remain in that position for at least an hour. Any other questions? How long will this be in me? So it ultimately depends on doctor's orders, but we want to remove it as soon as we can. And it depends on various aspects. So it depends on when I am monitoring how much secretion is being removed from your stomach, and also the diminishing of your symptoms, your no nausea, no vomiting, and no abdominal distension. So with those aspects, we can come to a conclusion of whether or not to discontinue your NG2. Do you have any other questions? No? Okay, Ms. Carmel, so I'm going to start preparing the NG2 and yourself. So what I'm going to have you do is first put some gloves on. And I'm going to raise your bed to working level. Raise level. And I'm also going to elevate the head of your bed also. So we're already here. Okay, now I'm going to turn the knob of the suction to about 30 to 40 millimeters of mercury. In this case scenario, I will do 40 millimeters of mercury. I am now going to start doing my pre-assessment checkups. So Ms. Carmel, I'm just going to start just doing pre-assessment checkups. So can I have you lift your head up to the ceiling, please? Thank you. So check inside your nostrils. Diverted septum. And while I'm here, have you had any history of nasal surgery or NG2 placement? No? Okay. And next, I'm going to listen to your bowel sounds and provide a light touching of your abdomen, okay? I'm just going to remove this just a little bit where I maintain your privacy, your modesty. So first, I'm just going to listen to your bowel sounds, okay? Let me know if you're in any pain. Okay, Ms. Carmel, now I'm going to provide light touching of your stomach. I see that your stomach is slightly bloated, so let me know if you feel any pain, okay? Any pain? No? Okay. So now, Ms. Carmel, this is where you're going to help me in this procedure, okay? So when I first insert the NG tube, I want to have you look up to the ceiling, okay, like this. And when I start to insert the NG tube further into your nose, I want to have you point your head towards your chest like this, and I want you to take sips of water. Can you do that for me? Yes? Great. So I'm going to place this near you so you can reach it. And now I am going to measure the NG tube. So it's going to go from the nose to the ear to the xiphoid process. Okay, I'm going to place some tape on that. And Ms. Carmel, I'm just going to place a towel on you, just because if anything gets soiled, I don't want it to get onto your gown or your sheets, okay? Okay, now I am going to take some lubricant, put it here, and I am going to curl the edge of the tube to my finger, my index finger, as it goes. It's kind of curved, and I'm going to down it with 3 to 4 inches of lubricant. Okay, Miss Carmel, I'm about to go in, okay? I want you to look up to the ceiling. Can you do that? Yes? All right, here we go. All right, Miss Carmel, I'm going in. Can I have you look down to your chest and start taking sips of water for me? Good, Miss Carmel. Pain or discomfort? Yeah, it's a little discomfort. I feel you. All right, Miss Carmel. We're here. We're here. Okay, Miss Carmel. I'm going to have you open your mouth for me, please, and say ah. Ah. Thank you, Miss Carmel. Just making sure that the tube placement is not jumbled up in the back of your throat. Now I'm going to do a chest x-ray to make sure that there's correct tube placement. A couple minutes later, chest x-ray came back and is in the correct tube placement. So I'm now going to replace the tube with some more tape. Wrap it around for more stability. Go. And now I'm going to attach the NG tube to the suction. All right, Miss Carmel, we are done. You did a great job. Yes. Thank you so much for helping me out. Yes. So how do you feel, Miss Carmel? Any pain or discomfort? No? That's great to hear. So Miss Carmel, I'm just going to clean up for a little bit, and then if you have any questions, just let me know, okay? Okay, Miss Carmel, I'm going to lower your bed down all the way to the lowest point, and I'm also going to lower your head of the bed, okay? Let me know when you're comfortable. You're comfortable? All right, Miss Carmel. So that concludes the procedure, and I will be back to check on you in an hour. If you need me before then, your call light is on your left side, and I have put all your belongings back to where it should be. And do you have any more further questions for me? No? All right, Miss Carmel. Thank you, Miss Carmel. Take care, okay? Opening curtain, closed curtain. So we have patient Candice Carmel, female, date of birth 1/19/1961, post-op day 2. She came in with diverticulitis resulting in a colectomy. It is March 19th, 8:05 a.m. As ordered by her physician, I have inserted a 14 French Salem sump at low intermittent suction of 40 millimeters of mercury in the right nair at 15 centimeters nair line, and it drained 100 milliliters of green fluid. Patient verbalized no pain or discomfort and tolerated the procedure well. That concludes my procedure. Thank you.